30th of June 2025. We don't seem to have Councillor Allison. We have Councillor Brown. I have apologies from Councillor Cooper. We have Councillor Fagan as chair. We have Councillor Lambie. We have Councillor Robb. We have Councillor Ross. We have Councillor Walker. We have Paul Manning. We have Jackie Taylor. I have apologies from Suman Sengupta. I've also apologies from Louise Long. We have Josephine Pravin Kumar. We also have Elspeth Russell. We have Hisashi Kubayama. I have apologies from Jimmy Wilson, and we don't seem to have Richard Gallagher. We also have a number of officers in attendance, and with that, I'll hand back to you, Chair.
Okay, thank you very much, Susan. Can I come to item 1, which are declarations of interest? Are there any declarations? There are none, so can I come to item 2, which are the minutes of the previous meeting? Before I open that up, can I just say there has been an error in the minutes. Councillor Robb was marked as absent, but was in fact present. So when I ask you to approve the minutes, I'll ask you to approve them with that correction. Are there any matters arising or questions from the minutes? There are none, so could I ask that we agree the minutes with that correction? Are we agreed? I'll see we're agreed. Thank you. Can I come then to item 3? Which is a report on NHS Lanarkshire's Anchor Plan, a progress update, and I'll come to Josephine Pravin Kumar from NHS Lanarkshire to speak to that. Josephine.
Thank you, Chair. And I also have Elspeth Russell, consultant in public health, who's joined me. So this is our annual report on the progress made with the Anchor Action Plan. So we want to report on good progress on many areas. We have been able to secure work around the health promoting health service as well as the employability hub. There are notable developments in those areas, but there has been a couple of reduction areas. And as if you recall, the Anchor Action Plan for the NHS, we report around the 3 pillars: employability, procurement, and the assets. So although we are still focusing on work around the service delivery pillar as well. So I'm just going to hand over to my colleague Elspeth to just take us through the paper, if that's okay. Thank you.
Hi, can you all hear me okay?
Yes, we can.
Great, thank you. Thanks, Chair. So if I can just take you through the report, what it's looking to do is just give you an update on year 1 of our action plan. So you'll recall the plan is a 3-year action plan from October 2023. So we are about halfway through now, and this is based on our year 1 progress, which was reported last autumn. So just a reminder of the overall focus on the plan is really about trying to shift the culture of the organisation to more intentionally use our levers around the wider determinants of health, very much aligned to community wealth building. As Josephine says, there are 3 pillars that we have to report back to Scottish Government on, or 4 pillars really, because we report on land and assets, procurement, and our role as an employer, as well as our overall leadership and partnership role in being an exemplar anchor. The 5th pillar is around what we do within service delivery, and while we don't report on that to Scottish Government, we do major on it in terms of our local plan, because we recognise that the touch points we have with our patients are one of our greatest assets in terms of being able to influence health and wellbeing outcomes, and recognising those wider determinants that often lead to people having poorer health outcomes, and what we can do to influence those wider determinants through those touch points and through our service delivery models are really key. So we have kept service delivery very much at the forefront of our plan. What the report does is just gives you some of the kind of highlights, really, the notable areas of progress that we've made in year 1. As Josephine touched on, the work around employability, very much linking with our council partners and routes to work around that. We have been able able to increase the number of placements that we've offered in 23-24 compared to the previous year for employability and apprenticeship placements, and they are targeted to particular groups such as those with disabilities and parents, particularly around the employability programme, the demonstrator programme, which has been very successful. The NHS Lanarkshire procurement team, they continue to try and increase local spend within the area, and we've been able to demonstrate that over the recent year, and also do some proactive work around the Meet the Buyer events, linking particularly with the work done with Lang O'Rourke and the Monklands replacement programme. So there's been Meet the Buyer events that the NHS Lanarkshire core procurement team have attended, but then there's also been more proactive work done by Lang O'Rourke, the delivery partner for MRP, and actually most recently there was actually one held in Hamilton earlier this year in March, where they did a Meet the Buyer event as well. We are keen to hone in on what we can do more around transport, and there's been a staff travel survey undertaken, and most recently, this is just in addition to what's in the paper, we had a vision session with our board around population health, and we focused in as one of the workshops on anchor, and transport came out as a key theme. So we are now going to be doing a workshop to look at our current transport offer for patients, and what we would kind of look to have as a future model, what the gaps are, and particularly looking at the inequalities focus around that. So almost taking a health inequalities impact assessment approach to that. So that's a very recent development, just in the last week that we've actually agreed to do that. So kind of hot off the press. We also are continuing with our work around using our assets, particularly our green health assets around our hospital sites, and you'll see there about the work we're doing with the therapeutic garden projects through the Lanarkshire Green Health Partnership and the Clydesdale Community Initiative, who again focus on targeting inequalities groups. We've also appointed a horticulture and biodiversity and grounds manager post, and there's ongoing work at the moment around mapping our green space, and also looking at how we can improve access to that green space to community groups. As I mentioned about the focus on service delivery, one of the key strands of that in terms of our tackling poverty agenda is about how we deliver financial wellbeing routine inquiry. So how we can ensure our staff are routinely asking patients, are they at risk of financial hardship, and do they need any support with their finances? So that's something that we've really majored on, and we've been doing training on around that over the last several years, but very much increasing it. And as Josephine said, we've been fortunate to be able to secure the Health Promoting Health Service team, which are a very small team, but they work across the acute sites to build capacity across the staff. So they've been really increasing the work that we've been doing there around holistic needs assessment, but particularly with that focus on financial wellbeing. We've also got our social prescribing networks that are now quite well established, and as I've mentioned, the Health Promoting Health Service team have been expanding what they do, and one of their most recent developments is to start discussions with the FNC Plus Centre, the Flow Navigation Centre at Kirklands, to look at how they can work with them. And this will build on some work they've already done with some pathways with the Scottish Ambulance Service. So looking at how they can support people who are coming into hospital and being discharged from hospital in terms of their wider social needs. So thinking beyond their clinical care needs. You'll be aware that there's been the expansion of the Care Academy and the 4 work stream under the Care Academy to now South Lanarkshire. So that's now a Pan-Lanarkshire initiative, and that's going well, and it might be something the Commission is interested in getting a more detailed input on at a future date around the work that's being delivered under the Care Academy and the particular focus there. Monklands replacement programme, that continues to develop. develop, and we're obviously very interested in the community benefits that can be realised through that programme. So in our most recent annual report in terms of the anchor plan, we had a summer school delivered on facilities management roles, and the one for the coming year is going to be delivered on engineering. And the MRP team have been doing an awful lot of work with Lang O'Rourke, the provider, to look at how they are doing work with schools and colleges, offering work experience, but also offering both vocational and graduate apprenticeships. So there's a lot of work going on there, and as I say, a really exciting summer school being planned, and it'll actually be taking place in the immersive suite at the hospital, which is another new development there. We're also linking with our Healthy Working Lives team, which sit with Salus, and looking at how we can deliver. And this is really about our anchor responsibilities to really link with our broader partners and local businesses. So looking at how we can support their health and wellbeing, and also linking with Business Gateway, the Lanarkshire Business Gateway, to really utilise the links and the pathways and the networks that they've got to try and reach as many employers as possible, but particularly those who are small or medium sized, or those who have lower paid staff, to look at how we can support their health and wellbeing. So in terms of the milestones that we set, you'll see in the spreadsheet that articulates the full plan, we were content that we are on track with our milestones, with the exception of a couple of areas, and those two areas were really around pensions and credit union, and around the community benefits and the community benefits gateway. Now, I've detailed in the report some of the kind of mitigating actions that we've been taking, and these have been kind of further developed insofar as we've been doing a lot of work. Take the credit union work first. So NHS Scotland have a credit union that our staff are all able to be members of, and what we've been doing is a piece of work to review the memberships by staff grade to give us a bit of a baseline. Our health improvement team have then been doing an awful lot of awareness raising of the credit union, so through things like Tackling Poverty Week, Staff Health and Wellbeing Week, and also some targeted work with some of our lower paid staff. They've been trying to raise awareness of the credit union and also get some feedback on the credit union, and why people maybe aren't interested in joining the credit union, or any challenges around that. And then what we will do is we'll be able to look again, working with any NHS Scotland Credit Union, to look at whether there's been an increase in uptake after 1 year, to see if that's improved. In terms of the pension side, we are currently going through, and we've just gone through in March, an auto-enrolment process. So once we have the report on that, we'll be able to see just how many staff have opted out, and then we'll consider any appropriate actions we can take. This is an area where we need to be mindful of just what our role is in this, but it's really about recognising that we do have a pension scheme, and making sure staff are as informed as possible of the benefits of that scheme should they want to participate in it. We have been liaising with other boards to see if anybody's done any other work around the pension scheme that we might be able to learn from. In terms of community benefits, I think we've maybe had some discussion here before around the community benefits scheme. So NHS Scotland have a community benefits portal. They've recently launched a toolkit around this, but we've not had much uptake of it locally. And what we're trying to do is look at how we can promote that portal a bit more, but also have discussions with the two councils around the community benefit systems that are used locally, and is there maybe a way of looking at things a bit differently and maybe streamlining. We are aware that the NHS one maybe isn't being as utilised as it could be, and I'm aware the South Lanarkshire one is well utilised and is has had a number of really successful matches. We've actually only had 2 matches in total on the NHS Scotland one, so there is some work to be done there, and we are looking to see how we can promote what we've got, but also if there's an opportunity to maybe kind of streamline around that. In terms of our own community benefits, out with what's being done through MRP, what we're working with procurement on is looking if there's a couple of maybe big contracts that we can work with them on to look at what benefits have been committed to by the contractor, and then how these are being monitored and followed up, just to try and get some learning on how the procurement process actually works in terms of community benefits, because a lot of it is delegated down to service leads, so it's not corporately monitored, and we're quite keen to see if there's anything there that we could do that might kind of improve things around community benefits, particularly linking with that community benefits portal, so that what we're getting as community benefits is very much in line with the community needs. And we're aware of some great work going on by both the councils that we think we can learn from in this space. So this is something that we're really keen to do a bit more kind of joint scoping work on. So I've kind of highlighted that in the paper, and I think just to note, and Josephine alluded to this, there are some constraints across the Anchor Plan. We've been very fortunate in getting the Health Promoting Health Service funding continued, and we've also recently had some funding allocated to have a dedicated public health programme manager, and their remit in the first instance will be to help lead and coordinate the Anchor programme of work, albeit they will also support wider areas of work too, but that will be a priority. So it will help us with some much needed capacity to really look at how we can maximise all the opportunities that could come our way through being more intentional around our Anchor work. So in terms of next steps, I've just highlighted that really what we've been doing is just reviewing our year 2 milestones, making some updates, and trying to align with some of the other corporate developments like the anti-racism plan and the Marmot Places programme that South Lanarkshire are part of. We have recently submitted a report just at the end of March on the nationally set Anchor matrix. And we've got a feedback meeting with Scottish Government later this week on those metrics and our return to government. So I'm very happy to come back to a future commission once we've got that feedback and we've reported that through our board, to bring that back to the commission and have a discussion about those metrics. And I suppose just to conclude, I think we are making good progress as an Anchor. I think we're making good progress very much in that partnership space. I think there's a real opportunity with the Community Wealth Building Bill for us to think how we can work not just between ourselves and the council, but also with all our other anchors, our higher education institutions, our further education colleges, and crucially businesses as well, some of the private businesses that are also doing some great work. How we can all come together through that kind of multi-agency approach to the community wealth building action plan that will be required of us under the legislation going forward. So I think it's a really exciting space to be in, and really looking forward to coming back with future reports. Thank you.
Okay, thank you very much, Elspeth. Can I ask if there are any questions? Could you please indicate now? And could I maybe ask, it might not be something you're able to respond to just now, but what struck me just on that point about the community wish list but versus the NHS National Services Gateway, the community wish list is very open. Like anyone can go in there and browse it, even just to, if you were a community group, for example, thinking, maybe not putting in place an application, but thinking that you might want to put in an application and put something forward for the wish list, it would give you the opportunity to go and see what kind of projects people are looking for funding for. But the NHS National Services Gateway, I think, is behind it's a system you have to register with, log into, and so this isn't the sort of the biggest issue you'll have to grapple with, but it did strike me that there's maybe something very simple and straightforward you could do there that would help sort of demystify the process to any community groups or other organisations that might see an opportunity in and sort of community benefits from the National Health Service. So I don't even suggest you didn't necessarily need to respond to that, but I just put it forward as something you might want to take back to NHS National Services. Okay, I can see a couple of questions here, so could I come to John Ross?
Yeah, thanks, Chair. It's not so much a question, it was just to thank Elspeth for her report. I think it's really exciting, and I think it's so encouraging to see the NHS moving forward like this. And I look forward to future reports because I think they're heading in the right direction. And as I say, thanks very much for your report, Elspeth.
Okay, thank you, John. And could I come now to Hisashi?
Hello, can you hear me?
We can now, yes. Yes.
Yeah, excellent. Thank you very much. Thanks, Chair, and thanks very much for the report, Elspeth. Great to see the strong performance from NHS Berkshire, particularly on the local spend, and I spotted the mention of the increase of spending with local, excuse me, small and medium-sized businesses, increasing from 31% to 42%. And that's the item 4.4. And what was the behind this impressive growth of spend with small and medium size? Is there anything you did differently, or what's behind this?
Elspeth, do you want to pick that up, or Josephine?
I'm really sorry, I can't hear any of the online speakers' questions. I can hear you fine, but I can't hear anybody online, so I'm afraid you'd need to repeat the two questions, and then I'm happy to pick them up.
Apologies about that. So I'll maybe come to Josephine in a second, but the first comment was from John Ross, which was just to congratulate you, I think, on the progress. It was a comment rather than a question. And the second question, and Hisashi can keep me right if I've picked it up wrong, was really about some of the progress on local spend in the report, and he was wondering what was lying behind that. But Josephine, I think, who heard the question, might be able to come in, so I'll come to her first. That might be fairer on you, Elspeth. Okay.
Thanks.
Thank you, Chair. No, thank you, Shashi. So I think your question was about the improvement in the number of small, medium enterprises that have engaged in the process. So I think that is in the partnership space, the work that Elspeth has been doing along with our both the council partners. So that is, I think, has made the progress, but we were also very committed to make sure that we might be able to have a more common anchor plan across the three key partners within Lanarkshire. So we're very much in the early stages of that, but looking forward, that might be an area that we would want to explore further and progress. So I don't know if Elspeth has got specific actions you want to refer to, Elspeth, in relation to Shashi's comment.
No, I mean, if it's particularly around the local spend out with what MRP are doing, we can certainly dig into that, because I think it is all publicly available as to what what spend is local. I think it's part of the procurement report each year, but I can certainly take that away and speak to you and Erskine, who's our lead, to kind of understand where that local spend has been driven from, because I don't know off the top of my head the full detail of it, but I'm happy to get that and give what information I can on it.
Okay, thank you. I'll come to Paul Manning.
Thanks, Chair. Elspeth, can you hear me okay?
Yes, I can hear you fine.
That's smashing. Listen, thank you for the report. I think it's a really good report, and it shows a real commitment on the part of the NHS to these aims and to making this work. And this is obviously, great synergy with what we're trying to do collectively is a community wellbeing commission. You mentioned just about the community benefits system, right, and looking to do more work jointly with ourselves in North, and that's absolutely something I'd be really interested in having a conversation on. So myself and Josephine both sit on the City Deal Anchor Network, and part of what's being discussed through that is a City Deal system, which exists already for community benefit and community wish listing. Now, our intention is to migrate to that City Deal system this year. North Lanarkshire are actually already using that. So that might well form a good basis for that sort of joint working that you're referring to. And part of the reason why I'd be keen to move to that is that there are already other organisations. I'll give you an example, the University of Strathclyde, who are posting benefits on that system that you need to be you need to be part of that network to get access to. So I'd be really keen for us in Lanarkshire to maintain a route in to those benefits that those organisations are making available. So thanks for that, and keen to have that conversation again in the future. Maybe similarly, the content that you mentioned about the community benefits relating to the Monklands Hospital replacement, and I'm keen to make sure that Douglas, who's here in the room with us, that we're tied in there with some of those opportunities. So you mentioned the summer schools around facilities management and engineering, right? And just hopefully we can get a tie-in and a direct link into that. And probably just a final point from myself, and I was really interested in what you were talking about in terms of financial well-being and that routine inquiry way of working that you've got. I suppose part of where my mind was going, first of all, was how do people feel about that as part of a healthcare engagement where they might not necessarily be used to talking about these things. But probably where it takes me to is the bit I'm really interested in is how you measuring the effectiveness of what you do in that space. And I think maybe offline that would be a good conversation for us to pick up along with our money advice people, just because there are maybe some lessons that can be learned there on both sides about how we take that forward and make it work. So listen, thanks Elspeth.
Thanks. If I can just come back on that last point, there's actually just very recently been a piece of work done that Public Health Scotland laid on to evaluate the financial inclusion pathways and look at best practice, because it's something that we've struggled with across all boards for a number of years to really embed in our patient interactions. So we were one of 4 boards that helped facilitate that piece of research. So we'll have some recommendations from that. But I think it would be interesting to look at a bit more locally, because what I'm very conscious of is when they are raising the issue, when staff are raising the issue, they're often then referring on to council or third sector services for that more specialist support. So we're only doing that initial engagement, and if somebody needs the support, referring them on. So there is then a resource, requirement there from the partners, and I think we need to be cognizant of that too. That if we're making lots of referrals, is there the support there to pick them up? But we have been able to get feedback from the partners on some of the referrals that come through from health, and where income has been maximised, for example, for people. So we do have some impact data and stories from that, which is quite helpful. So yes, and I'll definitely make sure. I think Douglas is linked into the MRP work, but I can certainly pick that up as well. And that sounds a fantastic opportunity around the City Deal portal. We don't need to use the NHS Scotland portal. It's just one that's there and we have used up till now. But I think if there's an opportunity to streamline both for community organisations and for efficiencies ourselves, then that would be a good discussion to be had, I think. Thank you.
Thanks, Elspeth.
Okay, thank you very much. I don't see any other questions, but before I leave that item, I'll just make the point I've checked there, and the City Deal portal is another one that you need to log into and register with, which seems like a weakness in the system versus what we were doing in South Lanarkshire. So I would take that up with the City Deal, okay, or the City Cabinet. Myself, I'll take that up with the City Cabinet. Right, okay. I don't see any other questions, so the report is just for noting. So I've just asked the Commission to note the report, and thank you to Josephine and Elspeth for their presentations. Can I come now to item 4, which is the Community Wealth Building Action Plan Quarter 4 update, and Neil Reid will speak to this report. Neil.
Thanks, Chair. So yes, this is the Q4 update on our Community Wealth Building Action Plan. It covers the period April 2024 to the end of March 2025. And we bring an update to you twice a year at Q2 and now at Q4. There are 71 actions within the action plan for 24-25, and the summary of progress against those is at 4.4 in the report, where we put a status against those actions and tell you how many are red, amber, green, etc. And you can see that 4 actions have been completed, 54 are green, they're going as we would expect, and 7 are red or amber. That's about 10% of the total. As usual, there is an appendix to this report which gives a bit of narrative against each of the 71 actions, and that's attached as the appendix to the report. And essentially that's it. The recommendation is that you note the content of the report. Thanks, Chair.
Okay, thank you very much. Can I ask if there are any questions on the report, and could I come to Kirsten Robb?
Afternoon, everyone. Interesting chat on the previous item as well. Just a few simple-ish questions on the report, please. On page 36, it talks about the 33 modern apprentices or apprenticeships. Would we be able to find out a bit more information about what those are and when they'd be advertised and things? It sounds good. At the weekend, I was in Glasgow there, and they were advertising climate ready 3-year modern apprenticeships in the Botanic Gardens there, and it was like about parks and green spaces, and I just wondered if some of those are starting to come through in our modern apprenticeships as well. The other question is on page 39 on the CEIF programme on energy efficiency, just to find out what the project was that was cancelled because we didn't get the match funding. And on page 42, it was just to check with the staff changes if we're going to pick up the stuff on credit unions, if that will be rolled out later in the year to make sure we cover that one. Thank you.
Okay. Okay, I think Jackie's going to come in and help with some of those questions. So, Jackie.
Thanks, Councillor Robb. I'll pick up a couple of these. I was just quickly trying to write them down there. In terms of the modern apprentices and the 33 that's referenced there, that is the award from SDS for us to progress with our modern apprentices this year. We have recently had adverts out for our trade modern apprentices, and that's drawing to a conclusion just now. I can provide separately a kind of breakdown of that that process and where we're at with that, if that's helpful. Mm-hmm. In terms of page 39, and you mentioned a CEIF project that was cancelled due to lack of funding. I don't know the specifics around that one in particular, but if you'll oblige me, I'll find the details of that out as well and circulate that to the Commission as well. And then while I'm on a roll around credit unions, again, absolutely this is something that we can look to take forward with. Our partners, the credit unions that exist, and also the team that sits under Tom. It is an area that we've explored in the past few years around progression, around development and promotion of credit unions, and definitely something that we'll pick up with Tom and his team going forward.
Thank you.
Okay, I don't see any other questions, so could I bring us back to the recommendations? We are asked to note the content of the report. So if we can do that, I will then bring us to item 5, which is on community wealth building legislation. And I'm going to ask Tom Little to speak to this. Tom.
Thanks, Chair. First of all, my apologies for not being with you today. Hope the connection holds for us. Yeah, so this is actually the first of 2 reports I'm going to present on the Community Wealth Building Scotland Bill, which was introduced on 20th of March of this year. And this first one gives an overview of the main provisions in the bill and its implications for local government in particular, but it will also be of interest, we think, to partner organisations. So the avowed purpose of the bill is to ensure or bring about consistent implementation across Scotland and use community wealth building to create jobs and drive economic growth. You'll see at 4.3 in this report that it introduces 3 new duties, and 2 of them, interestingly, are for Scottish ministers. The first is that they should produce and publish a community wealth building statement setting out measures that will be taken by the Scottish Government each year. And the second duty for them is to produce guidance in relation to both the production of action plans and the inclusion of community wealth building measures in strategic planning by public bodies. So there's also the third duty, which falls to us, it's to councils and partners, and that's to produce and implement action plans. So all this is expanded for you between kind of 4.4 and 4.6 in this report. And I'm going to summarise that by saying that we are comfortable that we are already doing most, if not all, of this kind of work that's been outlined through this bill. But we will be seeking to refine what we do going forward, and anything that's going to change significantly we'll certainly bring before the Commission. And one thing we do know already, given what I just said to you, is as it outlines at 4.7, as we do seek to improve what we do, we'll now have to take into account any guidance and direction that's issued by Scottish ministers as they comply with their duty under the bill. So lastly, I'd make the inevitable point that the financial memorandum that accompanies the bill anticipates costs that would be involved. And for local authorities alone, it's anticipated at 4.4 million per annum. And I just make the point at this time, there is no specific funding allocated towards this area. There's also additional costs identified almost inevitably for other partners, including health boards, colleges, regional transport partnerships, etc. So section 5 in the report, that's page 49 of your papers. That's next steps and recommendations. And as I said, we feel we are, as the Commission and the people that work to you, are well placed to meet the new duties under the bill. We feel we're ahead of the game here in many ways and hope to stay there. However, our strategy, our community wealth building strategy that was launched in 2021 is due for a refresh next year, 2026. And so that will take into account this legislation and anything that emerges from it in terms of guidance from Scottish ministers going forward. That is that first of those 2 reports, and the recommendation is to note the contents.
Okay, thank you very much. Can I ask if there are any questions? Could I come to John Ross?
Yes, thanks, Chair. It was really initially to welcome the report, Joe. Obviously, we've been well ahead of the game, been one of the first local authorities to introduce this, and it's really great to see this being taken up nationally and spread over the whole country. And I may as well say while I'm on it about the next report that the replies from officers to the government are excellent. I think I agree wholeheartedly with every one of them. So rather than take your time up in the next item, just like to say that I agree with those comments as well. Thank you very much, Joe.
Okay, thank you. I don't see any other questions, so I'll come back to the recommendations, and it's just simply to note the content of the report. So if you can note the content of the report, I'll come on, as has been preempted, to item 6. We'll stick with you, Tom. This is the community wealth building legislation and the call for views that was issued. Tom.
Yeah, that was a great segue from Councillor Ross, so thanks for that. So this is your promised second report on the Community Wealth Building Scotland Bill. And this is focusing on some more in-depth discussions that's going to be taking place around that bill. And in particular, the Scottish Parliament's Economy and Fair Work Committee is conducting the stage 1 scrutiny of the bill. And they issued a call for views to inform their discussions and deliberations on 4th of April. So there wasn't really much time to bring this to the Commission, so no chance to bring it to you before this meeting. But so the report that we're providing today is essentially the Council's response, but we're hoping that the Commission will be content with the contents. So at 5.2, that's page 52 in your report, your papers, you'll see that the committee set out a number of questions that they used to frame that they wanted our views on. And the Council's response is attached to Appendix 1. Forgive me. I would say that for the Commission's information, the committee is holding.
We can't take a call just now. They'll leave a message and we'll get back to you.
Apologies. The dangers of working from home. As I say, the council response is attached to Appendix 1, but you may be interested to know that the committee is holding an evidence session tomorrow at the Parliament, at which Jackie Taylor will be presenting us and will give evidence. I'm sure she's looking forward to it. I won't go through the appendix in detail, but you'll note the council has welcomed the bill pretty wholeheartedly, and we made a number of comments, including the agreeing to widening the range of public bodies which should take cognizance of community wealth building, and those are listed for you at pages 57 and 58 in these papers. We've also made some comments under each of the pillars in terms of further changes of law that may be required going forward, and we've stressed once again the need for funding to follow any direction on this agenda, should, as expected, any additional duties be asked of us. That's essentially this report, but with your permission, I'll make one final point. The bill was discussed at your progress group meeting, most recent one, and we discussed it at some length, and we have an intention to do some further review of the implications and the opportunities that have been provided by the bill, with the purpose being to bring before you any proposals that may improve how we take things forward. Especially, we think, probably around the role and the membership of the progress group, bearing in mind that extension of the range of bodies that have to take account of community wealth building. So that's there, not really a recommendation, more just a point of note, and the contents recommendation is that the contents of this report be noted. Thanks.
Okay, thank you very much, Tom. I think from my own point of view, this has, as Tom says, this is the council's response that is here for information and consideration. From my point of view, it was useful to see the point made about flexibility, that absolutely it's great that we've got a national push behind community wealth building, but actually local flexibility is important, and also good to see the supplier development programme highlighted in that response as well. Are there any questions? I do have one question, so from Josephine.
Just a comment, thank you. I think it was in terms of a point that was raised around the lack of resources, but the work that we need to do. And in terms of the anchor work or the community wealth building work, in terms of fitting with other things that we're doing and how we are able to identify those ingredients or specific factors that accelerate some of the support for the bills. And so I don't know whether it's not a question, but it's just reflection on how we can actually gather that evidence base around what is working the best, so that we can maximize some of the opportunities at each of our organizational, but also at a collective level. So something to reflect, I suppose, going forward.
Yeah, and I think that for me is a point that I kind of come back to time and time again. We want to see outcomes, we want to see metrics, and it's not all about just the outputs. Okay, I don't see any other questions, so can I come back to the recommendations, which are again simply to note the content of the report. And Tom, we're going to stick with you for item 7, which is on the timetable of our coming meetings. So do you want to pick that up?
Quite straightforward one. This just sets out the dates of the forthcoming meetings of the Commission for your diaries. You'll see 3 dates in particular at 3.2 that are after this meeting, and note at 3.3 that your progress group that I discussed earlier, that we will meet in between your meetings to take forward your agenda. Happy to take any amendments, and if anyone has any issues, please come back to me with the dates.
Okay, thank you. I don't see any questions on that point. It leads on to item 8, which is the forward programme for future meetings. So just stick with you, Tom.
Yep, happy to do that. Thanks, Chair. So we expect to add to the list that you will see attached to this list of reports that are coming forward, not least anything that emerges from that review that I discussed earlier in terms of the legislation, and we will bring you the reports in timely manners following these two. Thank you.
Okay. Are there any questions on that? I don't see any, so we can note that report. There are no items of urgent business, so can I thank everyone for attending and bring the meeting now to a close. Thank you.